how important is clinical supervision to building a smart practice? And so this question is really about getting clinical supervision yourself when you are in private practice. For most people, you get clinical supervision when you are getting your license, right? That's a requirement in Florida. For instance, you have to have supervision 100 hours over a period of, at least 2 years. And it's really an integral part of getting your license. I know, most states have some kind of requirement for a period of time of clinical supervision, whether you're a psychologist, mental health counselor, professional counselor, social worker, marriage and family therapist, no matter your license, you had to get clinical supervision. And most agencies do have clinical supervision, whether you're licensed or not licensed, hopefully on a regular basis. But when you're in private practice, it's not so clear about clinical supervision and how often you need to have it. Should it be a part of your practice and what that looks like? And so I'm a firm believer that having regular clinical supervision helps you to build a better practice because you are a better therapist. You're fresh on your skills. You're getting consistent feedback and you're around other people who are passionate about the field and you're staying up to date on, treatment protocols and, just making sure that you're offering the best services to your clients. So I think that if you are in private practice, you want to have an avenue for clinical supervision in order, again, to build that smart practice. And this is going to look different for everybody. So I can talk to you about the type of clinical supervision that I'm in. I'm in a group that meets once a month. We were meeting in person, now we're meeting on Zoom. And somebody presents a case every month and we all give feedback. We learn about, different approaches people have, different clinical, orientations and theoretical approaches. I couldn't get that word out. And, just like cutting edge treatments for a variety of different issues. And that's been really amazing and really great. I've really enjoyed that process. I've been a part of that. I can't remember exactly how long, like 3, 4, 5 years, something like that. And it's really holds me accountable and it's been a really great support. So if you are interested in doing something like that, start that in your community or start that in your group practice where once a month, this is a peer-led group where somebody presents, everybody gives feedback. Maybe you present on different themes, different, case conceptualizations. It's a really great way. Now, if you are going for a specific certification, like I am, working on my EMDR certification and training, then I have to have, case consultation as a part of that. There are other modalities that require supervision and consultation. I think consultation and supervision can kind of be, it's not exactly the same. And so you may be getting that a part of a certification that you're working towards. I think that is amazing. I think that's great. And that can definitely be doable. The other thing that you may want to think about is if you have a complex case that you hire somebody that is an expert in that area. Especially, you might be an expert in something, but the case may be, maybe something that you haven't seen before. You just want to get a second pair of eyes or some recommendations, or maybe there's something that you haven't considered. Every time I present a case, somebody always says, but have you considered this thing? And I've never considered it, or it was like something I considered at one point, but I never really, went back to it, in therapy. And so, clinical supervision just helps keep our clinical skills sharp. It gives us a different perspective. And I do think it is, a natural part of, being a licensed professional and having somebody that you can go to run things by. And it doesn't necessarily have to be 1 hour once a month or once a week. It can be as needed, but make sure that you have those people ready to go as needed for you. So I want to take a moment to thank our sponsor, TherapyNotes. If you're looking for an electronic health record that's really full service that can help you run your in-person or online practice, they have a portal where you can do your telehealth sessions. You can send paperwork directly to clients. You can take payments. They send reminders. You can bill insurance. And the thing that is really amazing about TherapyNotes is that they offer really great customer service. You can pick up the phone call and work through any issues that you have going on or just questions. Sometimes like, how do I do this? How do I do that? So I want you to examine your clinical supervision process. Is this something that you are a part of? Is this something that you want to start in your area? And right now is a wonderful time to start an online, Zoom-based clinical supervision group. You want to make sure that you are, getting the help that you need as a clinician. Even though you're independently licensed, you are probably an amazing therapist. Sometimes just seeing things from a different perspective, making sure that we're holding ourselves accountable and just staying on top of our clinical skills will help lead you to building a wonderful and keeping a wonderful smart practice. So I'm here most days answering your questions. I'll see you soon, everybody. Bye.